If you've been stretching your foot every morning and it still hurts, this video is for you. Plantar fasciitis is one of the most misunderstood things that I see every week. I'm Dr. Nate with The List, and this is where we break down what actually matters for your health so that you can know more and need less. So today we're going to be talking about plantar fasciitis. We're going to be talking about what it is, a lot of the misconceptions that I see. But for those of you watching, if you've had plantar fasciitis or know someone that does, we got our little foot right here. You get a lot of pain on the bottom of the foot. You either get it through the arch, you get it right on the heel, or you get it right on the inside. So we took this off of our skeleton. We got the inside of the foot, the outside of the foot. You're getting pain right inside that heel. So what is the plantar fasciitis? You have plantar fascia on the bottom of your foot that can get really, really inflamed. Now, a lot of things that I see people doing, it's that sharp pain, that pain first thing in the morning, the first couple steps, it can get really bad. In some mild cases, usually the quicker we catch it, the better. But what I see a lot is people start wearing running shoes or really cushiony shoes because that's taking away the pain. And something that I've kind of gone against the grain a little bit is orthotics. I actually don't like orthotics because that plantar fascia on the bottom of the foot, a lot of it is caused from poor footwear. So in health in general, in this realm, you can overcomplicate things. So I like to keep it really, really simple. People can talk about, the way you're walking and your gait and strengthening the hips, and all this is important. But if we keep it really, really simple, there's three main things. So the plantar fascia, again, bottom of the foot. What happens anywhere in the body, if we have a constant tugging or pulling, it's going to cause pain at the attachment site. So you may have the plantar fascia pain right in here, but a lot of times we see it on the heel or on the inside of the heel. So then you go to the podiatrist or go to your doctor, you get an x-ray, you see sometimes you'll see a heel spur, a little bone spur, and it'll be like, aha, that's why I have the pain. When really that's not the root cause. So if you have that heel spur right there, that means it's been tugging and tugging and tugging, and your body is really, really smart. So it's going to bring in some fibroblasts, and it's going to start building bone, trying to take that tension off. We see it everywhere in the body, but especially at the bottom of the foot. That process, that periosteal reaction, the reaction around the bone, is very, very painful. So ideally, we catch it before you start getting the bone spurring, because you can get bone spurring here, Achilles tendonitis, you can get bone spurring back here. We want to catch it before that. So the biggest thing is footwear. Again, I don't love orthotics. I had a patient a while back that she was religious about wearing her orthotics and all of this. And I said, are you open to an alternative opinion? And she goes, okay, I'll hear you. And I told her, and she almost laughed. No, she did laugh when I was like, we're going to try to get you out of your orthotics. Because what happens is you're throwing an artificial bridge under that foot, and those muscles that are designed to hold your foot up are going to get weaker and weaker. So you're going to get some temporary relief, and then your problems are going to get worse, and then you're not going to be able to walk around without having your orthotics in. You're not going to be able to walk around barefoot. So the foot is incredibly designed, and it's designed to act like a spring. So we don't want to weaken those muscles. It's kind of like back braces. I don't want patients wearing back braces all the time. I don't want people wearing ankle braces. It's going to weaken and further worsen the problem. It can be okay in acute terms. The cause is, again, the tugging at the attachment site. Another thing to kind of look at, especially if you have anything up in the calf. So there's three muscles. We call them Tom, Dick, and Harry. So the tibialis posterior, and then we have the flexor digitorum. So longest, flexes all these toes, flexor hallucis longus. All of the muscles originate up in your calf. So if you feel any like cramping in your calf, you got to get someone to kind of dig into that calf and release that. Those muscles come down, the muscle turns a tendon, the tendon goes through in here and goes down to the bottom. So I focus a lot on the calf when people have pain on the inside of the heel, but when you have the pain right on the tip of the heel, we'll focus in the bottom of the foot. But again, the biggest thing is footwear. I talked about the shoes, the running shoes. So running shoes are designed because you're going to be running long distances and you're going to be heel striking. So then, in my opinion, most running shoes aren't great to wear all day. So they're super cushy. They have a lot of arch support. Like I actually go the opposite direction, which is something that I love, Flux footwear. If you haven't heard of them, Flux, Flux footwear. You can check them out on Amazon. We'll put a link in the description below. But Flux footwear, you can also order from their websites. I wear that day in and day day out. And the reason that I do, they have running shoes, but it's a zero drop because it's like wearing high heels. So if that heel is way up in the air, that's going to tension the whole posterior chain, and that can cause some of the issues up in the calf. So I like the Flux footwear because it's a zero drop. So the heel and the toes are the same. So you're not essentially, I'm exaggerating, but wearing high heels all day long. So I love the Flux footwear for that. But I also like that they have a wider toe box because a lot of our shoes are crunching all of our toes in, which is also affecting the biomechanics of the foot. So if you're wearing orthotics, there's hope that you won't need them forever, and we want to start strengthening up that foot. So that's some of the common myths, but again, it's just tugging on the attachment site. A lot of times it's linked to footwear. Now, treatment wise, what I like to do is and maybe I'll take a video and show you guys this as well, but a lot of times they're like, ooh, I need to stretch out my foot. What I've seen clinically work the best is when we actually go the opposite direction and we work on curling all the muscles on the bottom of the foot, kind of like you're curling your bicep, you're curling all these muscles on the bottom of the foot and curling the foot under. You can do it where you have like a towel and you're kind of pulling the towel in with your toes. Sometimes I'll literally just take my foot and have them squeeze and flex those muscles, then I'll kind of grab it with my hand and just stretch it a little bit more. We need to wake those muscles up. If it's super painful, if you have that periosteal reaction, that painful spot on the bone, you can even get like a water bottle. You can get a tennis ball and roll the bottom of your foot, or you can get a water bottle and freeze it. And then you can just sit there on that frozen water bottle and kind of work that out as well. So working that out. If it keeps lingering, what we don't want is you don't want that plantar fascia to rip, right? That's definitely what we don't want. There is a technique, some physical therapists, some chiropractors use it, called active release technique that I really like. So it's kind of a pin and stretch technique. Another thing, if you haven't heard of it, SoftWave TRT, which is a shockwave technology. We've been getting incredible results. Like plantar fasciitis is like one of the easiest things to treat. In my opinion, especially with a SoftWave, you can just get incredible results. Sometimes like they'll have you wear like a foot brace where it's in like an ankle brace. At the end of the day, we have to correct the footwear. The footwear is majorly important, and we need to start waking up the muscles in the bottom of the foot. So plantar fasciitis, some people have had it, if you can catch it within the first like 2 months, it's easier to kind of nip. More chronic cases, that's where we kind of have to take the step to maybe do the SoftWave and the tissue regeneration. But a lot of times I don't like the orthotic route. Me personally, from what I've seen clinically, I don't like the surgery. If we can avoid all of that, so start with getting those muscles activated, start with the stretch, start with kind of the towel exercises, kind of rolling that foot out. But if that's not cutting it, find someone that does a really good soft tissue technique to work up into the calf, those 3 muscles that I told you about that go down into the foot, cross right through the inside. So if the inside of your heel is really, really tender, those muscles are running right through that groove. So that's something to look at. But again, you can check out SoftWave TRT. You can find someone near you. Usually, we see pretty drastic improvements in very few visits. I'm talking 8 or less. So it depends on the chronicity. The longer it's been an issue, the harder it is to get it to reverse on your own. But try those exercises out. If you guys have any questions or you want me to go more in depth, we'll probably be doing some more foot videos. So with like Morton's neuroma and things like that. But if there's anything specifically that you guys have, comment down below. And like I said, we'll put a link for the Flux footwear.